Yours.
Excellent. Perfect. Well, thank you guys all for coming. I think we just addressed it on the onset, but this is part 2 of immune support strategies. I think it was in April, or actually it might have been March, but when this all first started, partnered with the YMCA to do a part 1 on Facebook Live. So if you haven't seen that, after this presentation, I'll urge you to go back and watch that one, because there are some big rocks and specific lifestyle strategies that we talked about in part 1, and I'll go over those just a little bit as we go. But this presentation is really focused on the questions that I've been getting from everyone here and other people on Facebook and through email and from our patients. So a lot of it is just related to those questions, but just know there's a lot more to the immune system and strategies that I'm going to be talking about in this hour. So for those of you guys who don't know me, I do want to do just a little brief background about myself. I always like to do this, you know why I'm talking about this. So I'm a doctor of pharmacy. I own Sawyer Street Hometown Pharmacy. I'm also a certified sports nutritionist. So my take on pharmacology and pharmacokinetics and things is a little different than other pharmacists, because I try to look at it first from a nutrition and lifestyle perspective and use medication second. There's a lot of other good practitioners that do that as well, such as my wife, who I'm fortunate to have with me through this quarantine. I think I may have gone crazy without her, but so staying connected with people, and my wife's a nurse practitioner that practices in the same way. I do consult in the supplement industry as well, so it's something that, as you guys will see as we go through, medications and supplements aren't good or bad when talking about the immune system or health. They're just tools use, and there's just certain things to look out for. Medications, certain things to look out for with supplements, and I'll kind of give an overview and help to sort that through. But just know every individual is different. Just like your neighbor may benefit from medication X, you may benefit from medication Y. The same thing holds true for dietary supplements as well. And there's not a one size fits all, but as general rules, I'll talk about things that almost everybody is missing, and first try to how to get them from diet, and if that's not possible, how to pick out a quality dietary supplement. But that was where most of the questions were actually at. It was on some dietary supplements and then also on inflammation. So those are the things that we're going to focus on. And I think a big thing to keep in mind that as we move through these presentations, I've kind of my two passions are so proactive health and then stoicism. So you know me, you probably get a lot of stoic quotes, but Epictetus, just keep in mind, the more we value things outside of our control, the less control we have. So again, as we go through this presentation, there are a lot of things out of our control that affect our immune system. Big one is age, genetics play a huge standpoint, childhood, how we grew up, our economic status, all of these things that we first grew up with all impact our immune system. But what we really want to focus on is things that are inside our control. So we look at it, internals and externals, and we're really going to focus on in this presentation is the internals, what's in our control. Because you guys probably all seen the headlines about blood type and males and different ages and things. And those are things that are interesting to look at and things that we know increase risk, but we want to really look at what can we actually change to help with our immune system and help to live a happier, healthier life. So that's what we will focus on today. So what we're going to talk about today, I'm going to briefly review some of the things from part 1 that people had follow-up questions on, but just know part 1 was mainly focused on nutrition, exercise, and stress and sleep. So all of those things are kind of the foundation for the questions that we're going to be reviewing today. And I went through some actionable items in the first presentation, so it's easy for me to say, eat less, eat more nutritious food, move more, sleep more, but it's a little bit harder to say, well, what can you actually do that we know has a large impact? And that's really focused on in presentation 1. And today I've had a lot of questions on inflammation. So discussing acute versus chronic inflammation. So inflammation is neither good nor bad. But there are strategies when people talk about inflammation in a bad sense of chronic inflammation to keep that down. We'll talk about some specific strategies to help to keep that down, to make sure when we have an acute immune response that we're not overshooting that response. And then we're going to discuss some dietary supplements, and the ones that have been showing up more and more in the research. Big one, as you guys see as we go through, is vitamin D. There's a lot of factors for that. We'll talk about that as we go. Vitamin K2, N-acetylcysteine, and there's a bunch of other ones as well. But just know each person's very different. So just because I talk about something in a study doesn't necessarily mean you should or should not take it. So before starting or stopping anything, make sure that you talk with your pharmacist and your healthcare team to make sure it is appropriate for you. I didn't, because this presentation with the questions went longer, I kind of left out the conflicting headlines. We talked about that quite a bit in the first presentation on the conflicting headlines around some medications. So unless there's questions on that, that's something that you can go back to the first presentation, check it out. And then keep talking about this first presentation. So it is on our Facebook page, also on YouTube. You just type in COVID-19 immune support strategies. That was back in the spring that we did the first one. So feel free to check that out after this. Then we have a lot of videos where we go on more in depth about certain nutrients on our Facebook page. So always feel free to check those out too. If you have any questions, let me know. And I'm just talking fast to kind of get through this to get to the content, but just know to date, there are no known dietary supplements proven to prevent, treat, or cure COVID-19. So if you see advertisements suggesting this or individuals making such claims, they should be disregarded. So a big thing from this presentation is, because I don't have a patient-pharmacist relationship with you guys, just know this for educational purposes only. I can't stress enough talking to your doctor or pharmacist before making any changes. And another thing just to realize, again, is these simple stories, it's important to just be on the lookout for them. So we see different headlines popping up throughout the year, whether it was hydroxychloroquine at the beginning of the year, whether it was now the vaccine coming, which is great news, but it's something just to know that there's a lot of different factors, and sometimes when you hear a simple story or a headline, it's not always true. So in the supplement industry, the simple story this past few years has been CBD oil, which done a lot of presentations on that, but it just know a lot of these things are good tools, but it doesn't necessarily mean this one thing is the end all be all. And even with the vaccine, it's something just to know there's going to be more things that are going to insult our immune system, that are going to cause us challenges as we go through our life 10, 25 years next year down the road. So it's something that in addition to the vaccine, doing things that we can do to support our own health, working with the YMCA, the Oshkosh Senior Center, they have a lot of great tools to work on lifestyle and other aspects that are, in my opinion, the foundation. So this is another Stoa quote. I'm just gonna move past this so we can get to the good stuff. But so I've been known to as a pharmacist that doesn't like drugs. So just to know that it's something that we always look at lifestyle first before moving to drugs. But I want to get to the content here. I went over this a lot in the first presentation, so I'm going to get through this quick too. But just know that medication should never be the first thing that we jump to. So we always want to look at kind of our foundation. And the biggest thing is lifestyle. And then when we look at nutrients, it's important to realize too, a lot of people right now with the immune system are jumping to things to help to stimulate immune system with elderberry, echinacea, other herbs. And these things can all be helpful used in the right setting. But the more important thing is to have that foundation. So when I get questions that people ask, say, hey, JJ, should I take elderberry? My first thing is usually I have to sit down with them and see what they're getting from their diets. You need your micronutrients and you need your diet to be on point before you get any benefit from these other immune supplements. So just know that's why a lot of the nutrients that are coming up when we talk about vitamin D, zinc, and even N-acetylcysteine are so important, is because we're not getting them from our diet. So before jumping to herbs, we need to make sure that the foundation is there, and those herbs can be very helpful too. So I would be remiss if I did not I think this has been, the health department has done a great job of talking about this. It's going to be important for the foreseeable future, physical distancing and masks. So I will just leave it at that. This is, very important. And for us at Thanksgiving, it's kind of sad. I'm not going to see my grandparents, my family face to face. We're doing it over Zoom, but we're still being able to connect the best that we can. So yes, these things are important. And yes, we should be taking this seriously. So that is basically one of the most important things I can say there, but I will leave it at that because I think there's been a lot of discussion on that already. The health department did put this out, which I was very happy in March, about Resilient Wisconsin, and talking about how, in addition to helping protect our neighbors and those that are more vulnerable than us. So my big thing is I don't want to give it to one of my patients, give it to my grandma, no matter what the virus is or bacteria is. So these things are all very important, but we should also be asking, what can we do for ourselves and what can I do? And I just had a long conversation with my grandma this morning to teach people at higher risk how they can fortify their immune systems, things that they can do to be helpful, not only just not getting the virus or getting the vaccine, which are two very important things, but what can we do to move forward to make a more robust immune system. And in the first presentation, really focused a lot on the three goods here. And you guys can read these other ones, but it's very important to stay connected. So just having these meetings right now, again, it'd be much better if I saw you guys in person, but we are connected now, talking even over Zoom. So it's important. And then spend time away focusing on COVID-19. So although this hour is going to be spent on the immune system, and because the main topic with the immune system is COVID-19, just we should be spending time focusing on other things as well. And then things to reducing anxiety by reducing your risk. So again, masks and distancing, and check in with yourself. We talked a lot about this in the first presentation with a mindfulness practice. So I don't want to spend too much time on that because I want to be respectful for you guys' time, but just know there are many things that you can do, and there are many tools that you guys can use and reach out to if you guys are having any issues with anxiety and things like that. So where this presentation is mainly going to focus is on inflammation. So I've been getting, again, quite a few questions on how can I lower my risk of having an overreaction to no matter what the stimulus, SARS-CoV-2, whether it's influenza, whether it's pneumonia, what can I do to fortify my immune system? And the central task that I have when I sit down with patients and when I do these consultations is working on what's called ways to reduce baseline inflammation. So headline that you guys probably see, and a lot of supplement companies will use this, is reducing inflammation is important, and it is. So from a baseline inflammation standpoint, if we look at this graph here, the lower baseline inflammation we have, so this person in green here is probably living a healthier lifestyle. They're eating better food. They have better genetics and things that this person can't control, but they're probably doing a lot of things to help with their lifestyle, and that's what's going to lower inflammation the most. So when they have a stressor, so what this up curve is showing is, say, when you get an infection, say SARS-CoV-2, you're more likely to be able to respond to it better if you don't have a higher baseline inflammation. So in the next couple slides, we're going to talk about actionable things that we can do to lower baseline inflammation. And yes, I know a lot of this is outside of our control, but again, what we want to focus on what's inside of our control to lower that. And then you guys can use this to teach your friends and family about this as well. So lower baseline inflammation is number one. Number two is identify and address deficiencies. So when you see these studies and headlines popping up, why zinc, why vitamin D, and for some people, why iron, even for certain people with anemia, is so important, is that it's usually tied to a deficiency that we're not getting enough from diet. So we're going to talk about where these holes are at and how to fill them in with diet and supplements. And then we can cultivate anti-fragility. So these are things going to the senior center, going to the Y, working out, putting a stressor on your body that will slightly increase acute inflammation, but over time bring down chronic inflammation. And I apologize, my dog is barking in the background. Is that? I think it's probably more distracting to me. So hope if it's not too bad, I will keep going. So this is a good summary paper that talked about decreasing inflammation. And this is available. It's an open access paper. So you just type this into Google or PubMed and I'll make these slides available. You can read more about this as well. All right. And I think an important thing here to note is to strive for progress, not perfection. So each person's at a different level of health. So again, it doesn't mean that you have to be perfect. You have to go to the gym every day. You have to help with their diet. All right. So let me continue. So baseline inflammation. So the most important thing that we can do is looking at ways that we can decrease inflammation acutely. So medications are very important here. So if someone has hypertension, type 2 diabetes, COPD, autoimmune disease, there's a lot of things that I'm going to do and we want to focus on to treat the root cause, looking at lifestyle, looking at nutrients, looking at nutrition. But it's important to realize that medication management in the short term is extremely, extremely important. So we've had something that's been an issue this past year is missing doctor's appointments and not having access to doctors and not having access to making sure that we're checking on our blood pressure, making sure that we're checking to make sure our medications are working correctly, making sure we have access to medication. So again, making sure that if you have any of these conditions that it's being measured. So if we have hypertension, maybe it's as simple as keeping a blood pressure cuff at home. And if your blood pressure is going high, making a phone call to the office. Type 2 diabetes, again, blood glucose monitoring is extremely important, particularly when people's lifestyles are changing. We've seen a lot of people's blood sugars go up. So managing them with medications is going to first decrease this curve here so acutely. But what we want to do is really focus on how can we treat the root cause. And this is with lifestyle. And these things usually aren't quick fixes where medications are going to lower a blood sugar right away. But if we focus on lifestyle, focus on working with someone at the senior center of the YMCA or someone like myself, that we can really dial these things in, it's going to lower our chronic inflammation. So controlling the medical conditions that you have, and if it is possible to reverse them, and I'll tell you, quite frankly, it is possible to reverse type 2 diabetes. It's something that we've gotten people off of medications, helped them to decrease medications, but controlling with the medication can be a great tool. And then using lifestyle is very important for reducing baseline inflammation. Other risk factors increase baseline inflammation, things that we can do right now. So we just talk about smoking and alcohol. So quitting smoking and decreasing alcohol consumption are two difficult things to do, but are very, very impactful for decreased inflammation. But as a BMI goes up, so as our weight goes up, as our body fat percentage goes up, that puts on extra inflammation on the body. So again, not something easy to do, but something that I've seen great stories with Senior Center and the Y working with people to decrease body fat percentage. And that is going to have a long-term impact on their health, not only now, but down the road. So it's important to finding ways to exercise that are going to not increase your risk for infection, but to make sure that we're decreasing our inflammation. Chronic stress. So something right now that I've seen a big issue is being on social media a lot. Is something I've had trouble with when we're at home, doing a lot of things on Zoom calls and things going on. Social media is very easy, and a lot of the things right now are designed to basically hold your attention and create this stress environment. So not only real stress, but perceived stress is important here. And we talked about this in a lot of the first presentations, so I'm not going to go into the strategies. Sleep loss, which we'll talk about a little bit next, micronutrient deficiency, sedentary lifestyle. So just see that the things that we can do to increase this curve to decrease this baseline inflammation are a lot of lifestyle things, a lot of things that do take some time, but there are things that we can do right now that can have a big impact. And the big one that we're going to talk about, you guys probably seen more and more headlines, and if you are my patient, and I'm not sure if you're on a vitamin D, probably get sick of me asking, because it's very important right now to be taking a vitamin D supplement, and or to at least be knowing your levels to make sure that your vitamin D is in a range that we know is helpful for decreasing disease severity, which I'll talk about the studies as we go. But a big thing that keeps popping up, and finally more and more doctors are talking about it, is vitamin D levels. And why it's such a big issue right now is, you guys know, if you look outside, it's sun's not shining, it's winter, and we're at a latitude and we're at such an angle that we can't synthesize the vitamin D like we do in the summer. So our vitamin D levels really drop in the winter, and it's hard to get it from foods unless you're eating sardines or foods fortified with vitamin D. But getting those up is extremely, extremely important. I don't think I can stress that enough. If you're not taking a vitamin D supplement, or if you don't know your level, it's important to look at that. Omega-3 index is another one. So when we look at inflammation from a nutrition standpoint, what you can do right now, increasing smash fish. So this is sardine, mackerel, anchovy, salmon, and herring, is very, very impactful on inflammation. So when we look at omega-3s, if our omega-3 levels are low, and basically that's a fatty acid. So if we look at our cells, omega-3 fatty acids are involved in a lot of processes, but our cell membrane, or what's surrounding the cells, has a layer in it that's a lipid bilayer. So the lipids that compromise it are omega-3s and then other fatty acids. So if we're low in omega-3s, the cells aren't as flexible, which can also increase inflammation. So another high leverage, easy thing to do is increase the amount of omega-3s we're getting in our diet. And a way to know if you're getting them incorporated in the cell, there is a blood test that you can do. That's $50 that I will talk about. But now is not really the time to get a bunch of blood levels done, but it's important to look at these two nutrients. And vitamin D, not only on the immune system, not only on bone health, not only on serotonin production, but there's a direct link to inflammation and low vitamin D. So again, it's something that I don't think gets talked about enough, and it's finally getting more publicity because of some randomized controlled trials that have come out. But just know that vitamin D is a two-way street as well. So when you're under an acute stress, your vitamin D levels actually go down because your body is using up some of that vitamin D with that acute stress. But just know each person is different. So make sure you talk to your pharmacist or healthcare professional before starting or stopping or changing any of these things here. So I do want to talk about sleep, and this is a graphic I had on the last slide, but I've been having a lot of questions specifically on melatonin, so I just wanted to bring that back up. And sleep loss is a major factor for increasing the severity of infection. So if we have sleep loss, insufficient sleep, we decrease antibody production, we decrease natural killer cells, we increase inflammatory cytokines. So sleep loss will move you up that chronic inflammation curve. So again, it's not the underlying cause of sleep loss is very different from person to person. But one thing that I've noticed kind of with the lockdown and quarantine is not many people are getting outside anymore, and we're not moving that much. So all of these things are linked together. So getting outside, even in the winter, super important. Even on days like today where it's raining, if you can get out, go for a walk. It'll be very, very helpful for setting your circadian rhythm. Then from there, melatonin is something that's been shown to be very, very helpful and important, not only for sleep, but helping with the immune system. And our body can produce melatonin. And I talked about this more in the last presentation, so I don't want to go too in depth, but light is the biggest Zeitgeber, or basically what controls our body's melatonin production. So blue light in the morning, or getting outside in the morning, and then taking away blue light at night, so wearing some blue blocker glasses, not looking at screens, can be very helpful for your body producing melatonin. But if those things aren't helping, usually the first place that I look at for sleep, and not only for sleep, but for immune health, is melatonin. So melatonin is a supplement much safer than a lot of the other over-the-counter sleep aids. And it's something that has been shown to help increase immune function. And again, we want to help our bodies to make more melatonin. But after that, we can look at using a supplement like this product here. And dosing, I'll usually start people between 1 and 3 milligrams. It's something, there's a lot of higher dose supplements that are over the counter. I'd stay away from the 5 to 6 is usually okay, but the 10 milligram or higher is something, unless you've been specifically recommended, it's better to stay at a lower dose melatonin if you're going to take that supplement. And then I've been getting questions too, specifically on exercise. So we know exercise is a stressor. So that exercise is an acute stressor, but by having that acute stress, it actually makes our body more anti-fragile, which is a word that basically means that if you have some stress, you're going to make that stronger. So an acute bout of exercise, like going to the senior center, going to the Y, doing some resistance training, using some of the cardio equipment for a little bit, you're going to have a beneficial dose of stress, and that's going to help your body to decrease its chronic inflammation. For the general public, I don't even worry about this down here. This is more when I have conversations with athletes, so triathletes, CrossFit athletes, football players, and things that are stressing their body to the max. So unless you're running a triathlon or unless you're something crazy, just know that what you're doing at the gym is almost always going to be beneficial. And working with somebody like Siri or Alec can be very helpful to making sure you're getting that beneficial dose of stress. So even if we're not losing weight, even if you're weight neutral, putting some sort of stress on your body through physical activity, whether that be going for a walk, doing some resistance training, it's going to be very helpful for lowering that baseline inflammation. And acutely, it'll raise it, but over time, it'll bring that down. So from a cellular level, from mitochondria level, just for people who just need that little extra push, yes, it's important to get out and move and do things. And if you want to read more on that, specifically looking at aging, exercise is so important. And then I've been getting questions too on immunizations. This presentation, I probably could do an hour long on the COVID-19 vaccine, but it's something that will be very important in the future. And a lot of it, it's something I don't want to spend too much time on here. But just know, even though we're talking about a lot of lifestyle things, and you might think that I'm against some of these conventional therapies, there's a lot of things conventionally that can be very, very helpful, and influenza vaccines, pneumonia vaccines are no different. So making sure, in addition to doing these lifestyle things, that you're up to date on your vaccines. So if you haven't gotten your influenza shot, and I'm kind of pleading with you, it's never too late to get it. Most pharmacies still have doses left. And again, finding somewhere where it's safe just to get in and out. You don't want to have to go to a busy store to get it, but it's a real simple thing to do. Most insurances cover it with no copay, and it can be very helpful for reducing the burden we now have on the hospitals, as I'm sure you guys are all aware of. So some of the worst situations is someone has an influenza infection, then also has a co-infection with SARS-CoV-2. Those two stressors on the body are both going to be acute stressors. Remember, that's going to shoot things up. So yes, influenza vaccines are very important. If you haven't gotten one this year, it's not too late. And then making sure that we're up to date on pneumonia shots and pertussis, particularly for pregnant women, but for everybody as well. So just kind of an action step would be to calling your pharmacy or asking your doctor to see if they can check the Wisconsin Immunization Registry to make sure all of your vaccines are up to date. Because in addition to the COVID-19 vaccines that are coming out, these are very, very important as well. Okay. So, I mean, the most common questions I've been getting is on vitamin D3 and K2. So we'll kind of focus on that as we go here. But I do want to make a very important point that the most beneficial micronutrient for you is the one that's missing from your diet. And because each person's diet is different, it might be different from your neighbor or your spouse. So I work with a lot of people who have restrictive diets, whether it's a vegan or somebody eating paleo or a Mediterranean. Any diet that's restricting or cutting something out is likely missing a nutrient. So this is where we can be very strategic with food to make sure we're repleting these nutrients. And as you see as we go, a good safety net for almost everybody is a good multivitamin. So this doesn't mean a Centrum or a value brand multivitamin. It's a multivitamin you actually can absorb these vitamins from, but it's a good safety net for everybody. Then we get more specific. So the things that pop out the most for immune health and that most people are missing, again, vitamin D. You may talk about that again. All these studies bring up vitamin D because almost no one's getting enough of it. An important one to understand, and particularly if you're a female, getting blood levels of ferritin and iron is very, very important, because I think iron deficiency and low ferritin is something that's underdiagnosed. So iron is not a supplement you just want to take without knowing your blood level, because it's easy to go too high. But we have found a lot of people that are low, and then once you get your ferritin and iron normal, it can fix a lot of things. Just know, don't start taking iron without getting a blood level done. And then zinc, very important. It's one that almost nobody is getting enough of from diet. It's very potent and present in things like shellfish, so oysters and things that most people aren't eating. But again, looking at diet first, and then we look at supplements. So that's where, again, when we talk about supplements, and I can't stress this enough, first, we want to make sure we're filling in gaps first. So with the nutrients that we're missing from our diet, and then we can look at leveraging some of these herbals and things and or medications that can be beneficial, but looking at things we're missing first. All right. So I want to make a quick point too on dietary supplements. One of the reasons why a lot of doctors just stay away from it, because they're not, they've seen a lot of horror stories and they're not regulated like medications are. So it's super important to make sure that you're getting a dietary supplement that you know exactly what's in it, that the pharmacist has third-party testing, because even store brand supplements, so value brand supplements. So if you look at, because I'm 15, so looking at GNC, Target, Walgreens, and Walmart, a lot of their store brand supplements didn't actually have what was in there. And this continues to be a problem in the supplement industry. So just know, again, supplements aren't good or bad, but there's one extra nuance with there, and you just want to make sure you're getting a quality product. The biggest issues come up with CBD. So they basically don't buy CBD online. CBD is something that that there's so many counterfeit products out there because there's such a big margin and market in it. But making sure that you're using, if you're using a dietary supplement, that you're getting it from a brand and a company that you know and trust. And there's a lot of counterfeiting on Amazon and online too. So just be careful if you're ordering things online, order it directly from the company. Yeah, because that's super important. And one thing just to know with this, so over-the-counter items are regulated differently. So with Advil and ibuprofen, I'm almost always going to go with the generic ibuprofen, because I know that had to go through the same regulation as the brand name Advil, where all you're paying for is the marketing. But for dietary supplements, that's not the case. And I'll show just a quick example here. So we're talking about herbal extracts before. So we know things like elderberry, echinacea, astragalus, andrographis can all be helpful, but just because they're listed in a product, so say Airborne here, a very, very popular product. So just because your doctor, your pharmacist might say, hey, you might want to take some echinacea. If you see this on the label, as a clinician, I look at these proprietary blends and I say, there's no way for me to know how much echinacea you're getting when it's saying 35 milligrams of all of this combined. So basically what you're paying for in this particular product here is a high cost gummy bear. So the number one ingredient, maltodextrin, I'm sure you guys know, is sugar. So what you like, one easy thing, and it's reading supplement labels is pretty complex. There's a lot to go into it. So again, talking with someone who knows how to look at these, but making sure that ingredients are listed individually. So this is a product that's actually not out yet, but it's one that just as an example, when you look at ingredients, you want to make sure that they're standardized, they're listed separately, and then you can know the doses, because studies don't look at proprietary blends. They look at doses of specific ingredients. So another product like this is Virusid. That's a product I recommend quite frequently. And yes, we could stock airborne at our pharmacy, but like we could stock a bunch of other supplements that we could sell and make money on. But because it's just junk, we don't carry them. So just know that just because something has herbals in it doesn't mean that it's going to be effective. So let's talk about vitamin D. So vitamin D, we've had tons of questions on, and these next slides, I just want to show again, vitamin D hasn't been proven to do anything specifically with COVID-19, but the preponderance of evidence showing that many people can benefit from a supplement. It's super low cost. And as long as you're not going too high, it's super safe. And this is something important to talk to your pharmacist or doctor, because each person has a very different level that they should be taking. But someone who's low on vitamin D is going to have dysregulation of their immune response. So what does low mean? So we look at other studies. Let me just see. I think I might have skipped a slide. So actually, yeah, no, this is right. So when we look at people who are low, how big of a problem is it? And we look at the American population, 70% of Caucasian Americans have blood levels below 30 nanograms per milliliter. So this is lower than we want them. In the winter, it's even worse. And 90 to 95% of African Americans have blood levels below 30 nanograms per milliliter. So that's why it's extremely important to making sure that we're getting blood levels checked. And particularly if you're African American, make sure you get your blood levels checked. And being on a vitamin D is probably even higher leverage for you. And the reason is, you guys know, skin pigmentation has a big impact on how much vitamin D that you can synthesize. So even in the summer, someone with a darker complexion is going to have a harder time making vitamin D versus someone with a lighter complexion. That's why you see this disparity here. And there's other reasons too, but just know that it is a big problem and it is something that needs to be addressed. And yes, getting outside is the most important in the winter. It's just not possible. The UVB that's hitting our skin is enough to make it. So basically everybody could be benefiting from some supplementation or strategic food use. But when we look at, again, less than 30, people have more. Again, what we're focused on now is inflammation. So for less than 30, we're increasing inflammation. And then it's debated on what the sweet spot is. You'll see a few different targets as we go, but just know that it is possible to go too high. So making sure that we're either getting blood levels checked or that the doctor or pharmacist is specifically recommending a dose, because it's something that if you take a whole bunch of vitamin D, more is not always better. Okay. So then we look at kind of what the blood levels are and what it means. And this is actually a specific study that was the first randomized controlled trial. So in March, I talked about a lot of vitamin D from a mechanistic standpoint, from a standpoint of epidemiological data, that people with better vitamin D did better with COVID-19. But now we have a randomized controlled trial where taking or giving vitamin D in the hospital significantly reduced the need for ICU treatment in patients requiring hospitalization due to proven COVID-19. So what my main takeaway from this isn't that you necessarily need to be giving huge doses in the hospital, but we need to make sure when we're going in and having an infection, that our vitamin D levels are sufficient. So just another reason, again, very, very low cost, high leverage thing to do to making sure we're getting enough vitamin D. And I apologize for all this vitamin D, but I'm getting so many questions. I just want to make sure I make this point clear that it's very, very important. We look at different studies. The blood level varies, but somewhere between 40 to 60 nanograms per milliliter seems to be the sweet spot. And for certain people, some patients that work with multiple sclerosis and other things, even shooting that a bit higher can be very helpful. And then the next question I get is how to get that blood level. So the easiest way, and usually the lowest cost way, is just at your normal routine blood work. Just ask if your doctor can add it on there, because most insurances will cover that, and it's not very expensive to get it drawn, to have them test that when they're testing other blood work. But right now, again, it's not the time to overhaul doctor's office and get blood work just to get vitamin D. There are kits that you can mail in. These are ones that we sell in the pharmacy. This one specifically, an omega-3 index. These kits are $50, and they're good tools just to see where things are at. The nice thing is you can do it in your own home. just like a blood sugar test. You prick your finger, you put it on these spots, you send it in via mail, and they get your blood levels back within a week or so. So then you can kind of know how to target and dial in the dose, because depending on what your baseline level is, then we can add vitamin D in about 2,500 IUs. And again, this varies significantly from person to person, can increase 15 nanograms per milliliter. So kind of as a baseline, the IUs you recommend right now, somewhere between 2,000 and 5,000 IUs. So what we usually do is recommend this product here, D3 plus K2, because it has 2,500 IUs in it. And when people are taking other supplements of vitamin D, it's very safe. They're not going to go too high, but we know we're likely getting enough to hit that sweet spot. And then the next question I get, I think good, okay, is with vitamin K2. So vitamin D3, you should think of vitamin D3 and K2 as partners. So as we increase vitamin D3, it's important to increase vitamin K2 as well. And specifically looking at COVID-19, many people are low in vitamin K1 and K2, and K2 will help to replete both K1 and K2. Kind of above the scope for this presentation, but just know that low vitamin K levels can create inactive vitamin K dependent matrix clot protein. Basically, these proteins are needed in the clotting cascade. So vitamin K2 both regulates clotting and it regulates blood thinning as well. So in order to properly have that balance, we need enough vitamin K2. And it was shown in some COVID-19 patients that if they're low on vitamin K2, it can increase the risk of elastic fiber damage, which basically means clotting. We know that's a lot of issues coming up. And no, this won't prevent clots. Again, this presentation isn't, this is just information from studies, not to cure or treat anything, but just, again, we want to look at how we can reduce our risk. So very cheap, safe ways to add vitamin K2. So anytime you have a D3 supplement, looking for one with K2 is important. It is important for me to note that if you're taking warfarin or Coumadin or any other medications, make sure that you talk to your pharmacist or doctor, because just as someone who's taking Coumadin needs to regulate their green vegetable intake because of vitamin K1 has an interaction. So Swiss chard has an interaction with warfarin. Kale has an interaction with warfarin. Vitamin K2 supplements are no different. So if you're taking warfarin or Coumadin, you just want to take plain vitamin D3. For almost everybody else, you want to look for a product with D3 plus K2. And again, before starting or stopping, make sure you talk to your doctor. Another important note is if you're on a statin, so these are things like simvastatin and atorvastatin, not only do they deplete CoQ10, but they also can deplete vitamin K2. So it's even more important, people on statins, to taking some vitamin K2. And just so you guys know, most good quality multivitamins will have some vitamin K2 in it. So if you're taking a D without K2, you might be okay. Check out your multivitamin. But I can't stress it enough, before starting vitamin K2, talk to your doctor, talk to your pharmacist, because there are drug interactions there. The next big one that I've been getting questions on, and for good reason, is zinc. I think there's a couple big articles in the New York Times that I placed. I do realize I'm at 10:45 now, but I do want to get through these questions, and I have till at least 11:30. So, but I want to be respectful of your guys' time as well. So zinc is important. It's been shown to reduce viral penetration in healthy cells and replication inside cells. So that's why you'll see some zinc lozenges and zinc sprays. So theoretically, if the virus were to land in my mouth and I had a zinc lozenge, the zinc could potentially reduce the viral penetration and help with the replication. So for my bias for zinc, if you're going to be taking a zinc supplement on top of, say, a multivitamin, a lozenge or a spray is something that's potentially more beneficial, because you're going to get the absorption from the zinc. Then you have this theoretical benefit of having zinc coat the mouth. So for me, in addition to putting on a good mask before I say have to give a influenza vaccine or consult with the patient or something, and wash my hands, doing all those things, I will take zinc lozenges for about 3 times a day when I'm at the pharmacy. just for the theoretical benefit of if there were a virus come in contact with my oral mucosa, that it may decrease penetration and replication. One word of caution, I have seen people take these things too far, just like vitamin D. A little bit of something, or if you're deficient, hitting that sweet spot can be very, very helpful. But with zinc, no exception, going too high can be harmful and it can deplete copper. So it's something just to know. I would kind of put at the upper bumper about 60 to 70 milligrams of zinc a day. And if you're doing that, making sure that you're getting in some copper as well. But zinc can be very, very effective and helpful. And I'll just show you, I think, yeah, on this next, here's some products here. So one of my favorites is this zinc lozenge, just a low dose 10 milligram lozenge from Douglas Labs. It actually has 100 tablets, and it's actually, it's a professional product, and it's actually cheaper than like Zicam, which is the product that I carry, but I don't recommend that often. So you get 100 tablets for about $15, and doing 1 or 2 of these a day, or putting one before the grocery store at that 10 milligram low dose. We know we're not going to shoot too high, but you'll get some benefit making sure you're getting enough zinc. And then if you're taking one of these higher doses, like reacted zinc, it's something that you want to make sure you're getting some copper, and usually in a multivitamin that you can get some copper. And then the last 2 things, and then I promise I'll open for questions, that I've been getting a lot of questions on is glutathione. So glutathione is the master antioxidant, and it is available as a dietary supplement. To get a good glutathione product, it is pretty expensive, and we'll talk about a cheaper way to increase your glutathione stores from supplements without buying glutathione. And yes, glutathione is something that I use and recommend for quite a bit of patients for certain circumstances. But there's other things that we can do to increase glutathione. And if we look at glutathione status, we look at these markers. So if we look at diminished or reduced glutathione status, so whenever you have a viral infection or insult, when we see that acute and chronic inflammation higher, the glutathione is going to go down proportionally. So we want to make sure we maintain that reserve of glutathione, and anything we can do to decrease inflammation, we'll do that. But just know, yeah, dysregulated inflammation in the lungs is associated with low glutathione levels in the airway and epithelial lining fluid, and GSH, which is glutathione, appears to play a key role in supporting both immune surveillance and antioxidant and anti-inflammatory components of the strategy for addressing care for patients with COVID-19. So again, this doesn't mean that you need to take glutathione, but it's something that if someone has an acute illness, sometimes I'll have them take glutathione. Other times I'll have them take this amino acid cysteine. So, and I'll show you the form on the next slide. So cysteine is a rate limiting factor from glutathione synthesis. So if we don't have enough cysteine, we can't make glutathione. So a more cost-effective way to increase glutathione, and something that I have quite a few that I'm doing myself too, is N-acetylcysteine. And I got quite a few questions on N-acetylcysteine, and for good reason. This is something else that's been studied, some smaller studies, some bigger studies with COVID-19, even using it IV in the hospital with some patients, but it's a cheap and safe dietary, I should say, as a professional product. You want to get a good product, but it's a relatively inexpensive thing that can be very, very helpful for increasing glutathione. Another important thing with N-acetylcysteine, so whenever we look at lungs, if someone's having some mucus production, some trouble breathing because of mucus and that kind of that tightness in the lungs, that N-acetylcysteine can actually reduce that viscosity, so it can help to put it up. So instead of using something like Mucinex, which quite frankly isn't that effective and is more expensive than N-acetylcysteine, my preference is if you're having any mucus and congestion is to use some N-acetylcysteine. And I got questions on the dosing too. The dosing varies from study to study, but it seems somewhere around 600 milligrams up to 2,400 milligrams can be helpful for that, basically loosening things up. And another important thing is tea and plenty of liquids to help to rid that sputum. But instead of using Mucinex, N-acetylcysteine is a great tool for that. So looking at clearance first, but then, so not only can N-acetylcysteine help with that clearance, but it's in the glutathione pathway. So remember the last slide, cysteine is the rate limiting step for glutathione production. So this is where N-acetylcysteine can be a great tool. I just want to, okay, this slide has some examples of N-acetylcysteine. So these are ones that we have in the pharmacy. So Mitochondria is a professional multivitamin that has vitamins and N-acetylcysteine in it. And then you can just get single entity N-acetylcysteine. And these are products I carry and recommend, again, because I know exactly what's in there. But these things can be very, very helpful, particularly for older people or people that have a higher baseline inflammation, because again, when we look at that chart, younger people and people who are in a better physical condition usually have a higher glutathione store. So say if I gave this to an athlete or somebody in very good shape, they probably benefit from it a little bit, but it's probably not going to make that big of a difference. And is it safe? Yes. But where it make more of a difference theoretically is someone who has that higher level of inflammation. So someone maybe is a type 2 diabetic, maybe they have hypertension, heart disease, an older patient that I'm concerned about that might have some issue if they contract certain viruses. This is where using N-acetylcysteine at low to medium doses can be helpful. So anywhere between 300 and 1200 milligrams on a daily basis can be helpful. Then acutely can bump that up even higher. But again, talking to your pharmacist before doing it. N-acetylcysteine is very safe, but just like with zinc and vitamin D, you can get too much. So the cap for if you're going to be doing it on yourself seems to be somewhere around 1800 milligrams. So I wouldn't take more than 3 capsules of this N-acetylcysteine a day without talking to your pharmacist, because actually at very high levels, there's some smaller studies that show that it can actually act as a pro-oxidant. But again, if you're reaching for Mucinex, reach for these products first. They're going to not only benefit and clear that mucus, but they're going to help with the glutathione to help clear that quicker. So N-acetylcysteine is a great tool and something that I've been recommending quite frequently right now. These are just looking at different dosing because I had questions related to dosing. And again, just like with vitamin D, there's no one size fits all dose. With N-acetylcysteine, there isn't either. So somewhere between 300 and 1200 milligrams probably helpful. Me personally, right now, I'm taking 600 milligrams a day. And kind of the only downside of it is just like a higher dose vitamin C or other antioxidants. If you're taking it around exercise, your adaptation to exercise might be slightly lower. So if you are exercising, maybe just separating the N-acetylcysteine by 12 hours. Otherwise, it's very, very safe. And again, somewhere 600 milligrams is a good place to start. But going higher, and again, working with the doctor or pharmacist if you're having an some acute inflammation due to sickness might be helpful. Again, so this is, I think, a good quote. So, and if you're looking to dive deeper, this is actually just released at the beginning of November, N-acetylcysteine combat COVID-19 and evidence review. So again, not talking about treating or anything like that, but it might be helpful for reducing inflammation. So you guys can read this. N-acetylcysteine is inexpensive, has very low toxicity, and FDA approved for many years. Actually use it in a hospital for Tylenol overdose. So something, if you take Tylenol frequently, it's going to decrease your glutathione store. So taking N-acetylcysteine for you, probably even more impactful. But N-acetylcysteine administered IV, orally, or inhaled may suppress SARS-CoV-2 replication, may improve outcomes. I think the point I want to make here is, so we don't have to do IV or inhaled use. You want to get these kind of baseline levels of cysteine up before. So the easiest, lowest risk thing to do is just take a low dose of N-acetylcysteine every once in a while. And if you don't like taking supplements, just see if you get a multivitamin with some of it in it. But been shown to be helpful. Other ways to get glutathione up is, again, exercise, decreasing chronic inflammation. Okay, so those were the main questions I had, and then I'll get to questions here. But so if people ask me what dietary supplements should you take, it depends. Talk with an open-minded doctor of pharmacy. And then, so other question that's easier to answer is what dietary supplements have I recommended for people? And again, it's different from person to person, but we look at what people are missing from their diet. A good multivitamin that includes some magnesium, includes some K2, includes some vitamin C, is kind of the first place to start. So if someone's asking me about herbals and things, our first question, or usually I'll ask them questions about their diet, see if they're getting nutrients in. Before going to any of that, taking a good quality multivitamin. My 3 favorites, Alpha Base by Orthomolecular, Mitochondria right now because it has N-acetylcysteine, Pure Encapsulations has a great one. There's a lot of good ones out there, and there's a lot of junk ones. So just ask me or a pharmacist for good multivitamin, making sure we're getting enough vitamin D3. And then again, EPA and DHA, so smash fish, sardine, mackerel, anchovy, salmon, herring, and then magnesium. And the reason these ones are bolded, because this is when I go through dietary recalls with people, almost everybody isn't getting enough of these things. But otherwise, we can look at leveraging other things. And right now, there could be an argument that everybody should be taking a little N-acetylcysteine right now. But again, because there's ways that certain people can do it without taking a supplement, I don't have it highlighted. But there's other things that we can take too. But remember, most important thing is the foundation first, and then we can build from there. So actionable items, these other ones I talked in the last presentation, but it says supplement vitamin D, but probably know your vitamin D level and talk to your doctor or pharmacist, see if it's a good idea for you. And then from this presentation, most of the questions are on dietary supplements. So strategic use of dietary supplements, then all of these lifestyle factors. Again, these dietary supplements are just a small piece of the puzzle, but because this is the second one, and that's where I got the most questions, that's kind of my wheelhouse. That's where I spent the most time. Closing, choose your pharmacist carefully as you choose your physician. And if you guys do want more, I do consultations as well. But again, if you just need a question, always feel free to shoot me an email. Don't charge for any just one-off questions or stop in the pharmacy, or right now, probably best to do curbside pickup when we do offer local delivery. So if you ever need anything, have any questions, always feel free to call or reach out. And I apologize, I had a lot of content to get through. I probably talked too fast, but I know this is being recorded. So now I will open it up for questions, and thank you guys for all being here today. I really appreciate it.